Governor Allen, can you share your involvement with the commission, why you decided to join forces here, and what you've experienced so far?
Well, it was a great honor to be asked to be a part of this commission with 16 other really top-notch individuals, diverse people from all over the country in different positions of experience and leadership. And Kay James is someone who I think is just one of the best people I've met in my entire life. And she served as Secretary of Health and Human Resources in my cabinet while I was governor. And with Heritage putting this together, I thought it was a way that I could bring a sense of balance and the concept of proportionality to a lot of the aggravation that has been created, the devastation of jobs and livelihoods and lives and fear and projections and modeling and so forth. And the great thing about working with Heritage and the truly exceptional staff is that we put all our minds together. We have the same principles of trusting free people and free enterprise, recognizing that public health is absolutely essential, as is the free enterprise system, and that this isn't all going to come from the federal government. In fact, it leads probably and should be rightfully by government closest to the people, and that's the states and governors and localities, as well as private industry. There is clearly a role for the federal government, whether it's Congress, whether it's the executive branch and civil society. And I thought these recommendations that we all came together with were really good. And you're seeing already reactions to our recommendations. Our very first recommendation, and our recommendations are some to governors, some to local officials, some to Congress, some to the president, some to society and non-governmental organizations and so forth. And the first was, yes, follow data. Testing is important, but open up, reopen safely in places where there hasn't been any extraordinary, in fact, almost little incidents of this COVID-19. And you're seeing governors taking the lead. And I think they're showing the way, whether it's the governors of Tennessee or Oklahoma, Texas, Nebraska, South Dakota, Colorado, Florida, and others. And then there's others that are taking different approaches. And even in the Northeast, where the New York City, New Jersey, Connecticut areas hit the hardest, I commend those governors in the Northeast for putting together a compact of those states for procurement. I loved hearing the governor of Connecticut, a Democrat, saying, we want to control our own destiny. I thought that's great. That's the kind of thing I'd say when I was governor as well. So I think you're seeing governors not just looking at things in a very halting, delayed way, but looking at ways to safely reopen the economy, and some are doing better than others. And I think we see enough right now that in reopening, we want to do it safely. And these are what our recommendations say, and that is protect those who are clearly vulnerable. And those are, generally speaking, we're seeing it, that most of the deaths, the fatalities, are in nursing homes and long-term care centers. In Virginia and in many other states, the majority of the fatalities are in these long-term care facilities. Generally speaking, elderly people, those with underlying conditions, are disproportionately fatalities, as well as those in the minority communities, particularly African Americans. And so the people who are vulnerable need to be protected, whereas others in businesses ought to be able to come up with good safety protocols, disinfecting, sanitation, and protections, and let them reopen. And every day that we wait is just another day longer in ever getting to recovery and return to something that is close to normal, but things are going to be changed for long term. But I think that our recommendations are very positive, they're constructive, and they're not partisan. They're for all Americans, regardless of what state, what community, what region they're in, and regardless of their backgrounds.
Thank you, Governor. That is very true. And Charmaine, picking up on that, in fact, before I go to you, Charmaine, I want to say thank you to those who have asked a question. We'll get to those in just a moment. I would like to ask Charmaine to expound on something that Governor Allen said. We did bring together a group of 17 people who have quite a diverse experience in public health and government, disaster response, small business owners, people who have experience with large corporations. So Charmaine, what went into the thinking behind the group that was assembled, and how have their diverse experiences helped with the 179 recommendations we put forward so far?
You know, that's one of the things that has been the most energizing and inspiring about being a part of this project, Rob. Of course, it's always great to get to work with Governor Allen. And it just starts there. Governor Allen has brought to the table his expertise in what it takes to run a state. And Heritage Foundation, through working with the commission, has really emphasized the importance of the federalism approach and having a state-oriented solutions. But we then added in, we have someone who's representing education, another person who served as a health secretary under both Republican and Democrat governors. We have Noe Landini, who is heads up Junction Bakery, which some of our listeners may have visited down in DC and in Alexandria. So he has helped us focus on what it's like to be a small business owner in this crisis. We have representatives from the faith community, from Johnny Erickson Tata, who is a disability expert. So we're seeing people who bring very diverse perspectives, and in that dynamism of having that kind of conversation, we're seeing recommendations come out from some groups that are focused entirely on the economy and other recommendations that are focused entirely on the health concern. And those are important, but what is exciting about the recommendations that this commission has put forward, you mentioned 179, shoot, we should have gone for it and gotten 180, just to round it up. Governor, we'll have to fix that.
That's all right. We have phase 5 coming for the future. So I suspect we're going to be over 200 by the end of this.
Exactly. And so it's broad-based. One of the things that we've argued is that you have to have a whole of society approach to solving this problem. And there's so many different facets of it. We've also heard from over 700 people across the country who've gone to coronaviruscommission.org and told us their stories. So the report reflects not just the experts who have given of their time to serve on the commission, but also the stories we're hearing from real Americans all across the country.
Yeah, one thing, by the way, Rob, that's
Yes.
really important. I did one of these this afternoon with the Thomas Jefferson Institute for Public Policy, and we got calls from Florida and Tennessee and on a variety of different issues. And I've always encouraged, on whether it's Twitter or Facebook or any which way, any of you all who are watching tonight, we want to hear from you. Get your ideas, review these 179 recommendations. Make sure they make sense to you. We've heard from folks, and there was one we had in our first batch, and they said they interpreted it differently. So we rewrote it in a way that made it more clear. And it's I think, very important to hear from the owners of the government, the people, for any ideas that you may have that you think we should put in, because we're going to have our final report in June, but we're getting recommendations now as states reopen, and then the final one will be focused on what we need to do going forward and making sure we build the supplies and so forth. And in the event there's a recurrence, that the response is not shutting down the government. The response, in my view, we'll discuss that as a commission. But any ideas that you all have, go to coronaviruscommission.com, coronaviruscommission.com, and we love to hear your views, and your views are very helpful to all of us on this commission.
Well, Governor, with that, let's begin with some of the questions that we're receiving from our participants tonight. Catherine W. from the University of Pennsylvania asks, will we see a great difference between the individual states and the health of their respective economies based upon the dates that they decide to open for business? What other factors might come into play?
Well, Rob, if you don't mind me jumping in there, that really sets us up for a point that I think is essential that people understand. The it's not just the difference in the states moving forward based on how they open up. The question is, how are they doing differently right now as we make decisions moving forward? It's really, really stunning when you look at the data from a granular perspective. Over 70% of the cases across the country are in only 10 states. 77% of the fatalities are in those states. And so the difference in how this virus is affecting different states is really, really striking and really important. It's not just if you focus our attention all the way across in the same way across all the states, you're going to miss the fact that there needs to be focused attention at these places where we're having real hotspots and real attack from the virus.
I agree, and you're going to see again. We have enough evidence, and we'll see how it plays out. But what Charmaine said is true. That if you want to look at where the hot spots are, where it's just been a disproportionate amount of deaths and the contracting of this disease, there are places that are densely populated where people use mass transit, and in generally confined places. Nursing homes are high, sometimes it may be even a prison, but where people are confined and it spreads. The solutions are going to come on a local basis. In fact, even within a state, there are differences. Even Governor Cuomo in New York recognizes that upstate New York, which is more rural and less crowded than New York City, which is the most dense place, I think, in the US, that they may be able to open. A prime example, though, for you is a place called Bristol that I think the national media has finally discovered. And it's on the Tennessee-Virginia line. There's a street, State Street. On one side of the double yellow line is Tennessee. The other side of the double yellow line on State Street is Virginia. Tennessee has opened up. It's very sad for businesses on the Virginia side that are closed down because of government decree in Virginia to look across the street literally and see businesses, restaurants, and so forth opened up. And that's an example where if they followed if Virginia followed our approach, they would say, all right, the region of Southwest Virginia and Northeast Tennessee are really, it's the media market, everything's a community that works very close together, and it would make sense that area would be opened up as a region so they can work as a region. New York City is different than Sioux City. And then there's a place called Gate City on the Virginia side, and on the other side there's Johnson City, Tennessee. And those regions ought to open up together. And it's logical, say, in the Northern Virginia area, or say you in Pennsylvania, the Philadelphia area, which is mostly in Pennsylvania, but across the rivers, New Jersey, that whole area ought to kind of work together as a region, because there's a lot of people who live in New Jersey, work in Philadelphia, or vice versa. And so governors ought to work that way together by regions. And the same within the whole state of Pennsylvania. Philadelphia and Pittsburgh, and then everything else is beautiful countryside and great crops and friendly people and freedom-loving people as well. So I think that you're going to see that the states that handle this well and in a balanced approach are going to be those who are going to come out of it quicker than those that have halted with it. But that's the prerogatives of the people in each state and their leaders they elected, and there'll be measurement and they'll be held accountable in the future when we do an after-action review of who did well and who had the best practices. And I think having been a governor, governors are very competitive for their states, and the states that win, generally speaking, that are gaining population are those states with comparatively lower taxes, less regulations, right to work laws where people are not compelled to join a union as a condition of work, where they have affordable energy costs and a skilled, capable workforce from which to draw. And that's why the states of Texas, Florida, Tennessee, Arizona, Nevada are doing very, very well, and states with high taxes are actually losing population. And I think that may continue. if they don't improve it. We're looking at ways to improve the competitiveness of our country. On our commission, one of the recommendations we're making is to consider a payroll tax holiday where that would be less taxes on the individual worker as well as the employer for a temporary period of time. And that could help jumpstart our economy and make it more encouraging to hire more workers on nationwide. Then the states can compete with one another on their attractiveness.
Thank you, Governor. And as you indicated, one of the unique aspects of the Commission's recommendation is they're organized both by phases. So we've released the first 4 of 5 phases, but then they're also organized by audiences. So there are recommendations for state government, local government, the federal government, which includes both the executive branch and Congress, and then finally the private sector and civil society, which we recognize plays an important role here as well. I want to take our next question, which comes from Addison with the University of Notre Dame, Young Americans for Freedom. And he says,
great.
Addison says, what's the biggest obstacle to reopening the nation?
That's the biggest obstacle, leadership and understanding, and we're still learning. And I think you're seeing it in the states. Everyone's burdened by the same federal policies, but I think where you're seeing the differentiation is the leadership in the way that different governors are looking at it. And by the way, because a state has been, say New York City or New Jersey or Connecticut, have been hit hard and harder than any other part of the country. That doesn't mean that they have failed. They've done what the best they could do under those circumstances. But I think that you also, I hate to get into psychology, but some people are very risk adverse. I remember I'd always be trying to raise the speed limit on interstates, and people would be always worried about, if you raise the speed limit, the interstates are designed and built for 80 miles an hour. And to me, it's dangerous to drive 55 on an interstate. You'd fall asleep with it. But there are people who are more risk adverse. And I think that the biggest problem is the unknown, and leadership handling it in a balanced, measured, proportional way. And designing solutions that fit the needs of those particular localities. And I think those who are doing that well are benefiting the people and the livelihoods and lives of people in their areas while safely reopening, and others are just a little bit more halting with it.
Rob, I would pick up on the point the governor just made about the unknown. We talk a lot about the fact that this is a coronavirus. I think it's important to emphasize it's a novel coronavirus. That I really like that word because it communicates a lot. If we remember that it's never been seen before, that's a pretty remarkable phenomenon to be dealing with a biological agent that is completely new. Our scientists around the world are racing to catch up to this new scenario, and it's turned out to be a pretty nasty bug. It affects different people in different ways. It affects men much more dramatically than it does women. It affects different, as the governor said earlier, it's presenting differently in cities than it is in rural areas. We're still learning a lot about how it's transmitted and how infectious it is. So I think it's important to recognize how far we've come in a very short period of time. But I think it's also it also behooves us to be very sober and prudent about how we interact with something that's new, because there's a lot to learn for us as a culture and as policymakers as we think about how we react to something that's new.
Charmaine, maybe I'll stick with you on this one. Your institute at the Heritage Foundation includes our Center for Education Policy, and this next question comes from a student at UC Berkeley who says, many students are suing my school for tuition reimbursement. Do you think universities should refund students? And if so, do you think that colleges will be forced to shut down? I know the Commission's latest recommendations include some comments on what can happen in the higher ed space. Do you want to kick this off?
I think that's a tough one, and we're still in the middle of talking about exactly what the higher ed space is going to look like moving forward. One of the things that we have talked about quite a bit is encouraging the move towards the online approach, because the higher ed space is uniquely able to transition in a way to deliver their product online. It doesn't necessarily ameliorate these economic consequences that our questioner is alluding to. And I think it's one of those things that it's really a good thing that we have the summer to take a look at some of these structural barriers and structural concerns and start to see how we can approach in the ed space doing a better job as we move into the fall.
Being the Reagan Ranch Presidential Scholar for the Young Americas Foundation, I love all the young people who are involved in the Leadership Institute and for this education. And higher education, some of the smaller schools are going to have a hard time with this and just staying afloat. I think there's going to need, and one of our recommendations is to consider collaboration with other universities. The universities that have medical research are, I think, going to be part of the solution insofar as testing and research. Through all of this, while everything is unknown and we want to have data, we want to have testing, we're worried about our hospitals are going to be so inundated that they're not going to be able to handle it. So therefore, hospitals were shut down and people weren't getting immunizations and dental services and all the rest. We're seeing that, and say New York City again, prime example, they send up the naval ship Comfort, and they create the gigantic hospital in the Javits Center. Well, they weren't needed. And so a lot of things that were a reaction to forecasts, heck, the president was talking about the original modeling was 1 million to 2 million Americans dying. It's going to be obviously a fraction of that. And that was based on 50%, I think, of people staying at home, keeping your distance and washing your hands and so forth. So I think the colleges and universities that are mostly made up, obviously, of young people who so far haven't shown to be a group that has a high fatality rate, will have different approaches. I was Mitch Daniels, the president of Purdue University, I think is showing great leadership, and I think he may be one of those that others may want to emulate, not just in Indiana, but across the country as they safely reopen. And those that hate to be humorous about things, but you got to have a sense of humor. Somebody, I think it was on Tucker Carlson's show or Jesse Waters or whatever, and they said, tell the Southerners, you got to stay home, otherwise you won't get football in the fall. And but I think that would apply in the Big Ten country as well.
Okay, our next question comes from Julia from the University of South Carolina, who asks, if there is a resurgence of a COVID-19 outbreak in October or November, what actions do you believe state and federal government should take? A lockdown or 2-month quarantine again? What are the ramifications on the economy long term?
Well, go Gamecocks. Our youngest daughter is graduating from the University of South Carolina. We had a party last night in Cinco de Mayo for her. They won't obviously have a graduation there at the Horseshoe in Columbia, South Carolina. Here's what I think in the future should be, and I think this will be part of our phase 5, Charmaine and Rob and others with our commission, is that it should be targeted. I think that if there's a spike, you look at, right, first of all, it should be analyzed by zip code, not just county, but by zip code. And if it is a senior center or long-term care facility, if it's a prison, if it is whatever, the people who need to be protected, who are vulnerable because they have these underlying conditions, and maybe it's a heart problem, maybe it's emphysema, maybe it's pneumonia or diabetes, whatever, and we're learning all this. And those folks really need to be protected and they need to be quarantined, whereas all the rest really need to be able to go and work. I would hope, and it is my goal, is to find ways that in the event that this virus recurs or any other such event arises in the future, that never again will be the government response will be to condemn and shut down people's businesses, their property, and their livelihoods.
Rob, one thing that I would mention is that two of our commissioners are medical doctors. Dr. Bill Frist, who was the majority leader in the United States Senate for many years, medical doctor, and also Dr. Richard Tubb, who was involved in the Bush administration in the response to the SARS outbreak. So in working with them and having them look at the science, the report that we just released yesterday involved phase 3, which talks about focusing in on the science and building the science. And look, I'm always going to be an optimist. As we look forward, I think we do have to be prudent and sober about the possibility of the virus coming back in the fall. That's what we're hearing from the experts. We don't disagree with that, but I would say that every single day we're growing in our knowledge of how to fight this thing. And one of the things that's really encouraging to me, looking at phase 3 and the recommendations that we put out there, is that we've been hearing from clinicians on the front line. It's a little discouraging because what we're hearing is they've been so much in the midst of the crisis of dealing with what's right in front of them that there hasn't been as much communication amongst, say, the physicians on the front line in New York with the physicians on the front line in Los Angeles. We believe the commission is speaking into this place and helping to bring people together and recommending to the Centers for Disease Control that they step up and provide strategic pathways for those conversations to be happening in ways that helps to develop the science and takes us to the next level in our approach in developing therapies that will best tackle what the differing kinds of ways that people are presenting with the virus. So I'm really optimistic when you look at how far we've come in a short period of time, and you look forward to the time that we have in the fall. I believe that we're going to make tremendous progress by then.
And we are making a lot of progress.
Yes.
We really are. And some of it is part of similar recommendations, acting on our recommendations on turning down a lot of the regulatory roadblocks to a lot of research. And that people are, and I know that the Vice President, Mike Pence, said how much they appreciated our commission being created. And some of the roadblocks that are being kicked out of the way have a lot of competition amongst pharmaceutical companies and others coming up with therapeutic antivirals as well as vaccines, which normally take years. And we'll see if they get them done or not. But I think what we're finding is a lot of creativity and recognizing that all businesses, what's going to happen, Charmaine, clearly is, and listeners, viewers, is places are going to have to be disinfected. Workers are going to have to, their safety is vitally important. Customers coming into a facility are going to want to have the confidence that it is safe. And so for the workers, the employees, for the customers, all need to be safe. And I think we're finding ways that'll work. And some of this distancing, people keeping their distance, that's going to be with us. And for at least a while. Same with washing your hands, and but clearly sanitation, disinfecting. In fact, that they're talking about these cleaning the subways in New York City, maybe for the first time in 115 years. But those places were just filthy. You all see those videos of rats eating pizza in the New York City subways, but the subways, mass transit for a place like New York City is absolutely essential for that type of place to function, because people can't afford to have a car there. The parking's too high, taxes are too high, and there's simply a lot of reliance on mass transit. So each place is going to react differently, but I think the basic things that Charmaine, that you led on in phase 3 make a great deal of sense, of following the science, following the data, and act on it, but not act in fear. So don't be paralyzed by fear. Do it with information, knowledge, and moving forward.
Well, that's a good lead into our next question. Before I go to that question, I want to remind our participants that they can find the full set of recommendations at coronaviruscommission.com. And you can also leave us your ideas and recommendations for how we should reopen America. We've relied on the more than 700 that we've received already, and we would love to have your ideas as well. The next question relates to public education and I suppose personal responsibility that Governor Allen and Charmaine were just talking about. Sierra from Young Americans for Liberty at Ohio State University says, what is the strategy for getting the public on board with opening as early as we want to? And I will tell you that I had the opportunity today to take my two elementary school children to a dental cleaning, and the dentist told me that the biggest challenge she has right now is convincing her employers, her dental hygienists, that it's safe to come back to work. She said the customers are ready to come back. It's some of the employees who have fear. So what do you recommend that we can do to make sure that they feel safe and secure?
Well, one of the things that we have recommended in phase 3, which is the chapter on building the science, is that there are a lot of people who are fearful and having a difficult time with something, as we said, that is so new, of sorting through the science. There's almost too much that's out there, competing perspectives, competing, dueling data sets, right? And I think it's been very good to hear consistently from the White House task force. We called on the administration to continue communicating in a way that as the science develops, that they're using technology in ways that gets certifiably good and truthful information to the people as effectively as possible. There's a website called coronavirus.gov, where our argument is that the administration should be using tools like that so that they can put the information that people can have a confidence and a trust in knowing that they're getting good information. They should be, as we learn and know more about how we can most safely move forward, they can be doing communication vehicles patterned after the opioid advertising, so that we're able to get out there and reassure people how is the best way to move forward. And Rob, I had to smile because one of our listeners kind of stole my line. I saw them say, "Grandma was right." At the end of the day, all of our grandmothers have been vindicated. There's some really basic common sense things that public health are telling us that, Governor Allen was saying, wash your hands, don't be shaking hands, get good sleep, eat right. And we'll be maintaining social distancing in terms of not being in very tightly, densely packed areas for some time moving forward.
Great. Well, let's go to the next question, which comes from Isaac from UMass Lowell. Isaac, I'm going to ask the second part of your question because I think we've answered the first. It says, how can the state government ensure that all people follow the rules to wear a face mask? The lack of mask resource or disobedience with the order. If schools reopen in the fall, who would have the authority to implement it? It's very risky when the number of cases is quite high, but a small amount of some people can trigger a second outbreak in a community.
Well, first of all, supplies are going to be very important going forward. PPE, that's one of our supply chains. So much of our supplies are coming from China and elsewhere, and so we need to stockpile more PPEs. I think we probably now have enough ventilators. Manufacturers of automobiles we're not making, whether it's Ford or GM, weren't building Tahoes or Broncos or pickup trucks. They were building ventilators, and others are shifting into face masks and gowns and gloves and all the rest. And it's, the manufacturers in World War II, not that this is World War II, but World War II, the manufacturers were called the arsenal of democracy. And manufacturing in the United States now is the arsenal of health. And so for people who need masks to perform their jobs, or if people want masks going around anywhere, then we need to have supplies of it. And we're ramping up very strongly. Now, the question on who's going to enforce it, this gets into a really interesting point, and that is our civil liberties are not to be limited any more than they already have been. And any limits on people's freedom needs to be, and we have this in our recommendations, the least burdensome alternative or least strict way of enforcing whatever the law or regulation or protocol is. And so there are going to be people, again, who are very worried. Your dental office situation that you're talking about, Rob, are some of the dental hygienists who are really key for scraping people's teeth. You see more of them than the dentist who comes in only if there's a problem. So it's going to take people some time to have that confidence. What we're trying to do, and as Charmaine said, and especially in phase 3, is don't be paralyzed by fear. Understand what we have learned, what we are gaining, knowledge we're gaining, and what are the very best protocols to make one safer. So I think that if some state says that people have to wear masks, I think there's going to be a lot of people not wearing a mask. I'm not talking about people in a restaurant or a manufacturing facility or a dental office or any medical office. If you're going to make people walking around and they're keeping their distance, you're going to say everyone's got to walk around wearing a mask. Everyone's not going to wear a mask. And you saw this situation in Dallas on the news where this woman opened up a hair salon and the judge gave her a 7-day sentence. It's just absurd out of that. Somebody's just trying to open a business and doing it safely. And so I think those that are too heavy-handed and if they don't make sense to the people, many people aren't going to follow it. And it makes it very difficult for law enforcement when you become over-prescriptive in ways that don't make sense or don't make common sense of necessity of the inconvenience of such laws.
Our next question comes from Hannah from the University of Wisconsin at Green Bay, who asks and says, I know that the president has talked about the possibility of having a vaccine by the end of the year. Do you think that is possible? And if that does not happen, is there a plan moving forward for the future?
I think the vaccine is difficult. I will say I agree with Governor Allen that I keep thinking about the same example he used, the arsenals of democracy. This country has a history and a track record of putting the pedal down and finding solutions where there weren't solutions before. So I remain an optimist. I will say that the vaccine is a more difficult task than finding the therapeutics. I'm seeing a lot of real innovation going on and real progress going on in the clinical realm. And so I'm more optimistic that we're going to find therapeutics and ways to deal medically with the coronavirus. And that will be another way of tackling this. You know, we have gone through coronavirus trajectories before. And so scientists are fairly optimistic that summertime is going to give us a little bit of a reprieve. So I think there's several different routes that lead us to finding ways to cope better than we are right now.
I agree. I was on a nanotechnology call. I was the author of the National Nanotechnology Initiative, co-sponsor with Ron Wyden. And we're talking with doctors, and Charmaine's exactly right. I think the antiviral therapeutics are much more likely to be prevalent, and there's much advancements in that area, and that'll all be available really by this fall. Just think of the fact that everyone says we've cured AIDS. Well, there's never been a vaccine for AIDS. It's being handled and saving lives with therapeutics. The same with dengue fever. On the other hand, things like polio and other diseases like that, it doesn't have, they call it genetic drift or mutating. I hate to get into science, but you're college students, so here's your science course. If COVID-19 mutates, if it changes, it's much harder to find an effective vaccine. And you have to make sure the vaccine is safe and does no harm, then you got to figure out if the vaccine is actually effective on top of it. And so we still don't know. In fact, there's even questions whether the virus that hit the East Coast in New York City is different than the one that hit the West Coast, and whether it mutated from Italy to, say, New York City versus the ones from China directly. It all came out of Wuhan, China, but all of that's the science that's got to be figured out. The other thing is there's, and Charmaine talked about the innovation of our private sector. There's a company called Centera, who's has, and I got to look at it more, but they call it UVC. It's a the C as in Carolina, C-ray of ultraviolet light for using ultraviolet light for disinfecting. It is the same effect as the sun, and it's been shown that the sun kills off this virus. Hot, humid, sunny weather is great for killing off the virus. Now, in indoor places, using these ultraviolet technologies is a way that could be used to clean airports, airplanes, office buildings, hotels, a variety of places that sanitation and disinfecting surfaces is really important. So I think we're going to find many great ideas in making sure that we are safer and reducing the incidence of the contracting of this disease, as well as therapeutics, which are much more promising than a vaccine that may take as much as a year.
Wonderful. I have a couple of questions that I'll combine here as we're getting close to the end of today's digital town hall. Susanna asks if the commission is engaging entities like the U.S. Chamber of Commerce and the Department of Labor and Department of Education. And Daniel asks about the National Association of Manufacturers and how they can become more helpful in assisting the president in the economic battle with China, given its lack of fair play concerning pharmaceutical issues. So I'll, Charmaine, maybe you can talk about some of the experts who've testified before the commission, and then Governor Allen, I'll let you handle that one about NAM.
Okay.
Right, exactly. The head of the National Association of Manufacturers, Jay Timmons, came and gave us testimony in front of the commission. So we've been hearing from a pretty diverse group of outside experts, as well as the experts who have given up more of their time to serve on the commission. So with that, Governor, I'll let you elaborate on that a little.
Yeah, well, one of the things that the National Association of Manufacturers cares about, and in fact, it crosses all businesses, even Mr. Landini's restaurants and all the rest, is a worry about liability. There are these shark plaintiffs' lawyers who are already looking to file lawsuits, and manufacturers and indeed all businesses need to have some liability protection if they're making a good faith effort to comply with CDC guidelines for the safety of their working men and women, as well as their methods of production, even for pharmaceuticals. Then they should have that safe harbor. One of the things that manufacturers, we already mentioned that the arsenals of healthcare. So they're ramping up, helping supply chains and a variety of ways of getting, especially this personal protective equipment to those heroes, those frontline healthcare workers who are risking their health and lives every day. I think what the manufacturers will understand, would like, and as far as safe supply chains, we have so much that comes from China, and I think for America, for all manufacturing, for any businesses, we need to make sure that America's United States tax and regulatory policies make the United States the best place in the world to make anything. And then I think we'll be more secure that way. They'll be good for jobs. And what that means is you have the right tax, energy policies, regulatory policies, work with the government to recruit creative people so that we can have the most advanced manufacturing in the world. We have the energy in our country. We have our tax laws are much better now with the tax reform of 2017. We once had the highest taxes in the world on incorporated businesses. Now we're better than average. And so we want to make sure that you're always looking at the competitiveness of our country, and whatever can be done nationally as well as at the states ought to be done, because like most people, we like to see things made in the USA. And for our supply chains, if it's not made in the USA, part of phase 4 that we talk about is make sure that we have it with reliable, trusted trading partners. The passage of USMCA means we can maybe get more of our supplies out of Mexico or Canada. We also recommend in phase 4 a trade agreement with the United Kingdom, as well as Europe, Japan, South Korea, those countries. And I think all of that is beneficial to freedom-loving countries. It's beneficial to American consumers and beneficial for more job opportunities here in the United States. If you have a government policies at a state or federal level that say our state's open for business or the United States is open for business.
Our next question comes from Christian from Piedmont, Virginia College, who asks, should we be worried about the novel coronavirus evolving to spread through animal populations? If it can evolve this way, it would heavily damage hotspot urban areas even further.
I'm going to let Charmaine answer this question, but my father-in-law taught computers at Piedmont, Virginia Community College. It's outside of Charlottesville, just below Thomas Jefferson's Monticello. I have Thomas Jefferson right behind me. There. All right, Charmaine, you answer the question.
You know, I think that's one of those questions that we don't know the answer to. We did see that there was one report of animals getting coronavirus, but it hasn't seemed to have spread within the animal population so far. So I don't think that that's something that people are particularly concerned about at this juncture, but I don't know that we have a definitive answer on that. There's still a lot to learn about this virus.
The big worry is that the packing sheds for poultry and beef and hogs. Some of those have been hot spots in South Dakota, Iowa, also on the eastern shore of Virginia and Maryland. And so those are facilities that need to be safe. It's not because the animals have the virus, it's that the workers get it. And so that's really affecting our supply chain for meat. And that's another area that needs to be focused upon.
Well, we have another Virginia College student here. This one comes from Kelsey from the College of William and Mary, College Republicans, who says, notwithstanding the turn of the legislature in Virginia, why should Virginia protect the right to work law in an effort to protect its economy and jobs, which are even more at risk due to the effects of COVID-19? Governor Allen, you want to take that one?
Look, if you care about Virginia being competitive and attracting more investment and more jobs, our right to work law is really essential. I spent more time as governor trying to get business to come to Virginia, and we were very, very successful. We'd go up to New York and New Jersey and get businesses to come to Virginia, and international businesses. The first words out of my mouth in promoting Virginia was, we're the furthest state north on the eastern seaboard with a right to work law. And businesses, if you don't have a right to work law, you won't even be on the field of competition. And it's a matter of personal liberty that someone should not be forced and compelled to pay union dues as a condition of having a job. They can organize, they can join a union if they so desire, but they shouldn't be forced to do so. And in fact, there's empirical data that shows that states that have right to work laws have much more growth in population and jobs and opportunities than those who restrict that freedom of workers. And so it's absolutely essential. And in fact, if you got rid of the right to work law, I mean, that would be so damaging to Virginia. It's sad that it was even considered and got some traction in the last General Assembly session. When that was going through, in fact, I wrote an op-ed on how important the right to work law is. And I was thinking, gosh, if I were the governor of North Carolina or South Carolina or Tennessee, Georgia, states that compete with Virginia, I'd be saying to any prospect, some decider for a business, you don't want to go to Virginia. You don't have the certainty that they won't knock out the right to work law. And so I think it was a mistake even to, it's I think harmful that it's even considered seriously by some leaders in the Virginia legislature. But fortunately it was defeated, and hopefully it stays graveyard dead and gone. I'm talking about repeal. I'm talking, but we should keep it, definitely.
Well, thank you. And I also want to thank all those who've asked these great questions tonight. Very, very insightful and detailed questions. The next one comes from Nicole with Indiana University Turning Point USA chapter. What's the most important thing that the public needs to know during the transition period to reopening?
I think they need to know what their local circumstances are. Going back to the fact that there are 10 states, only 10 out of 50, that have 77% of the cases. There are a whole handful of states that have had 0 fatalities. So I think knowledge is power. Knowledge is a way of reassuring yourself that that not every area is affected as deeply as some of the hotspots that are getting all of the headlines.
Charmaine and Governor Allen, maybe as a follow-up to that, we have a question that says, why can't we encourage those who are part of vulnerable groups to quarantine and let healthy people function as normally as possible, self-quarantining when they feel sick?
Well, they should. That's the personally responsible thing to do now and in the future. And I think most employers who want to have these Good Samaritan protections are going to have these type of policies that if somebody is sick, feels sick, don't come into work, don't contaminate or spread this virus to others. There was a question, one of the earlier questions about what if this recurs, in any sort of smart targeted approach is that anybody who has symptoms needs to be isolated or quarantined. And don't in such a way as that they're not infecting others. And so that's definitely the approach that ought to be taken. It's just common sense and personal responsibility.
Okay, and we're going to use this as our last one, and it's a great setup for both of you to talk about what the future holds for the commission. Stephen Clifford from Louisiana State University, Young Americans for Liberty, says, what can we do to prepare for a future pandemic?
What a great question. We're working on that right now for the final report that'll be coming out in the second week of June. There's a whole area of different facets of getting ready for the next time. I think one thing is to be realistic about the fact that people have said, well, why didn't we have enough ventilators, or why didn't we have enough PPE? Because the definition of something being new is that it was not necessarily predictable. We may not be able to know that we're going to stockpile exactly the X, Y, Z specific targeted thing that is going to help address the next one. But what we can do is look at our systems that are of how we work together and what our processes are as we move forward. One of the things that the Heritage Foundation was writing about even before this pandemic started, and that we've been referring back to a lot, is how difficult it is to be innovative and to move fast in a bureaucratic environment when you've got a lot of regulations. And so that's one of the things that we're going to be very focused on, both as we put together the final chapter that looks at being ready for the next pandemic, but we'll be sounding that theme as we move forward, of saying one of the reasons that the testing was such a challenge in the beginning was that we needed to let go of some regulations that weren't serving us well. And that's going to be true for getting us set up for whatever comes next in the next challenge, because there always will be a challenge over the horizon.
Well, let me finish with, first of all, congratulating the LSU Tigers and their great national championship. Go Tigers, G-E-A-U-X, Tigers. And thank you for your question. And we do need to reduce the future risk of future pandemics, whether it's this one or another virus. We've talked enough about how it needs to be targeted in the future. We've learned a lot from it, as Charmaine has said, and we're still learning. And I think we need to make sure that supply chains are reformed. We do need to stockpile these antiviral therapeutics, particularly for this COVID-19 or novel coronavirus. And I think it needs to be invested in these various stockpiles, and it'll be a combination of the states. I like what the Northeastern governors are doing and having a consortium, a compact of states, so they have better purchasing procurement powers with it. And I think that'll be a state and federal responsibility. I think that obviously we're going to try to get whatever vaccines, and some of these vaccines and some of what's going to come will not be from the United States. There's some promising work in Israel, in Europe, and places like France and Britain and Japan. And so whoever ends up with the best approaches, we need to make sure we have it for those vaccines. And I think we're also going to need, because we want to get back to international travel and international trade and travel even within the United States. And I think some biosurveillance type aspects are going to be essential for trusted travel for people around the world. Now that's going to take a while for people to feel comfortable with it, but these are some of the things that we're going to be looking for in the future, where you have targeted approaches for outbreaks, but we're much more ready and have a much better supply chain, a reliable supply chain, because you have stockpiles of it ahead of time, and also just the management of it, where I think it'd be much better if the federal government, or you had someone helping on this distribution, where you're getting it to where it's needed the most. It's like firefighters, where you're going to send out the fire trucks. And you may have a lot of different fires, but there's some conflagrations that are bigger than others, and that's where you're going to need to send out more resources and equipment. So I'm confident that we're gonna get through this. Like Charmaine, I'm optimistic, because I think the United States, built on the concepts of individual freedom and equal opportunities for all, property rights, our free enterprise system, as well as other freedom-loving countries, we're going to come up with ways that are much more targeted, much better approaches than caging free people and free enterprise. And the sooner we're uncaged with smart, reasonable, proportionate ways of handling this, the better off we'll be. And it's a great honor to work with Rob and Charmaine, the Heritage Commission, and this entire, the Heritage Foundation, and this entire commission. And young people have some great ideas, great questions, and please share with us what you think ought to be done. It is your future. It is your future that's also getting loaded with a lot of debt with all the spending on this. So it's really important that you all, as smart, young, informed, interested, and active young leaders, we want to hear from you. Your voices need to be heard. And so please go online, share with our Coronavirus Recovery Commission your ideas, because it's your future that we care most about. And you're going to be the leaders that will be carrying the torch of freedom for generations to come in a much more prosperous and less fearful society.
That's so true. Thank you, Governor Allen. Again, that website is coronaviruscommission.com, where you can find all of the recommendations and leave us your ideas for how to reopen America. We've been really grateful for all who have participated tonight. We're also grateful for those leaders throughout our country who are paying attention to the recommendations we're putting forward. Kay James, who's the chairman of our commission and president of the Heritage Foundation, serves on President Trump's task force, so she's delivering the ideas directly to him and the White House, and we're doing the same with governors, local leaders, and the private sector. I want to remind our participants tonight to take the survey from the Leadership Institute to let them know how tonight's event went. And I want to thank Charmaine Yoest, my colleague at the Heritage Foundation, and former Virginia Governor George Allen, for your excellent information that you shared with us tonight, answering so many great questions from our participants. We hope you have a great evening. We will encourage you to stay safe, heed those guidelines, and do your part. As Kay James says, we will get through this together, but it will require us all playing a role. So thank you, and have a good evening.
And thank you to Morton Blackwell and the Leadership Institute for your tremendous leadership as well.